come for us to have a look at the budget and make our various comments so that we can return them to the Service Improvement and Finance panel tomorrow for Chris to take away and report back to Cabinet. So very warm welcome to all members, very warm welcome to officers, and also a very warm welcome to the Cabinet members as well.
And I just say thank you so much for chairing this joint meeting, Paxton.
That's all right. Don't worry about that too much, Sue, that's fine. Obviously, it is an important meeting and we need to take a very good look at what's going on. But before we do, let me start with the meeting proper. Apologies for absence first, Liz.
We've received apologies from Kevin Griffiths and Cheryl Philpott, Chair.
Thank you, Liz. Item 2 is disclosures of interest. Anybody got any disclosures they would like to make?
Yes, Chair. My daughter works for social services, so I will declare a personal interest.
Thanks, Chris. Item 3 is a prohibition of votes and declaration of party whips. Item 4 is public question time. I don't think we've had any, Liz, have we?
No, Chair.
Okay. So straight into item 5 then, draft budget proposals. Obviously you've had a chance to see the presentation I think that Jane has prepared, but I'm going to ask Jane whether you would like to take us through it, please, Jane.
Yes, of course I can, Chair. I don't know if Louise, I'm going to say a few words first, and then I'll take us through the presentation. If that's
thank you. If you don't mind, Chair, just to sort of make some general comments, and then Jane and officers will go through the more detailed presentation. And then I don't know if Alison or Hayley wanted to chip in as well, as they're online too. Yeah, obviously we have had an uplift in the money available to us, which is very welcome. But as we know now, as our discussions in both adult services scrutiny and child and family panel have as everyone is aware, we do have increasing demand and increasing complexity of demand, which is making things very challenging. So we've gone into this round of budget decisions, really with our principles in our heads, as always, those principles of early intervention and help, of promoting independence and making the most efficient use of our resources, and also our commitment to co-production in working with our communities, with our individuals and their families and carers, and also making our proposals in line with our target operating models in child and family and in adult, which we've talked about in the past. So that's all in the presentation, and Jane's going to go through the specifics with you. But always really grateful to bring these to panel today and to get your thoughts and input on it. Thanks.
Thanks, Louise. Before you start, Jane, what I should have said, because it was said unofficially before off the record, how pleased we are to see Dave Howe's back, and I should have mentioned that formally at that point in time. So my apologies for that, Dave, but we're very glad to have you, and you heard what you've been told already. Just stay healthy. Thank you. So over to you then, Jane.
Thanks, Chair. I'm just going to share my screen, hopefully, and I'll take you through the presentation, and then we'll take some questions at the end. Bear with me, sorry. Hopefully this is going to work. Okay, is that can everyone hear me and see that okay?
Yeah, that's good to me.
Excellent, thank you. Okay, so let's just start at the beginning, and Louise already alluded to it, but actually we have seen a substantial uplift in funding for social services for the 25-26 budget. It equates to around £28 million extra in the budget, which is about a 16% uplift. But there is still some significant pressures that we have to deal with to help us to balance the books. Those inflationary pressures, pay awards, and obviously national insurance, but notwithstanding the increased demand and complexity of services required as we go forward. Just a note as well in terms of grants, we are reliant on a heavily amount of grants funding. This is the third year now that we have flat grants, so that is substantially a challenge as we move forward. So just as a reminder to give us some context in terms of what we're talking about when we talk about the budget, the total operating budget for the Directorate is £28 258.5 million. So it's quite a significant budget pool. 196.1, or so I think it's at 0.3 at the moment, is RSG core funded. That's 76%, and the remaining 24% then is made up of grants and incomes from fees and charge and recharges as we go through it. So in terms of context, that's what we're dealing with for 25-26. Just a kind of reminder about our budget principles. You know, you will have seen these before around how we've established these for several years as we go on now, looking around maximising those income, minimising overheads and management costs, most effective ways of working, both in terms of a workforce and models of care, making sure we prioritise that safe statutory offer, minimising the reductions for prevention and early help, because we know that's helping us to actually draw down the recourse for more expensive statutory provision, and making sure that our grants are delivered within the envelope. And then basically we've taken those principles then and applied them across when we've been developing those target operating models that I know that the both scrutiny panels have talked about across the directorate, to make sure that those target operating models and the transformation plans all align to the medium-term financial plan. Now I'm going to pause for this one, and I'm going to hand over to Amy to talk us through the description of what those target operating models look like. Amy, hopefully it's on the call, and is that okay?
No,
Thanks.
certainly, yeah. I'll just do this really briefly, because as mentioned already by Louise and Jane, you've had this information before, but just to show that the child and family operating model and the adult services operating model, we put them in a triangle, with the idea being the majority of our work is at the bottom of that triangle, which is prevention and early help. We call it slightly different things, but it's that offer to individuals. The position at the moment, the reality is the very top sort of third of this triangle around that managed care. So whether that's accommodation and support for child and family services, or an adult services managed care around residential care or dom care at home, or direct payments, or a supported living provision, is the vast majority of our expenditure and our activity at the moment is in that top sort of third of the triangle. And really what we want to do in our operating model is to do a bulk of our work in the prevention early help space, always recognising that there will be people who need care and support in managed care. So we want to make sure that we have those resources available so to do that, and also that care is available at the right support at the right time. So the middle section of the triangle is around our early help and interventions. So these will be this support that's needed for individuals that we offer at the moment across child and family and adult services, but that allows people to step down then into more preventative and early help support, and then those who need it will go into our more complex care provision. So that's in terms of our operating models for all aspects of the service. It's underpinned very much by our business support teams, our performance teams, our training teams, and ensuring those systems and processes work really effectively across all the service areas, and our cross-cutting themes of enabling communities as well. So that's underpins our activity there. It's a whistle stop.
Thanks, Amy. It's quite hard to describe it on one slide, I have to say, but I think it is to how we capture it in terms of what we look like as we move forward. Okay, just going to cut across to the grant pressures before getting to the detail of the savings, because I don't think we can't move away from understanding those grant pressures when we get into the other one. So we have got some uncertainty around Welsh Government, still with the Welsh Government grants, and we do rely on quite a huge, a substantial amount of grant funding, 68 different grant schemes. Planning assumptions again is always that they're going to remain flat, which is a problem as we get into the third year. But then obviously thinking of the principle about the delivery of grant funded services contained in the budget envelope, and then how those grants align to the target operating model, as Amy's just described, to make sure that we're actually making the most of them, and that transformation piece of work. So we estimated the gap for 25-26 was 3.6 million when we were doing our planning. We think we have mitigated and closed that gap down to about 600,000 through. There have been uplifts in some of the grant areas, but still waiting for confirmation on a lot of them. So it's just really to think about those grant pressures alongside the overall budget position, not just the core budget as we talk about. So if we're going to just jump to the savings proposals now, which is in the papers that you've seen. So these three are the existing savings proposals. We looked at these last year, and there's the continuation of them into 25-26. So it's around those back office efficiencies, which looking to reduce staffing costs through natural vacancies, making sure our management structure is the most lean it possibly can be, making sure that we only draw down the minimum amount of core funded required to bring down the capital grants. So capital grants is an example in terms of when we put in capital schemes, we make sure that we're reclaiming our costs in that way. So those three are continuation from last year into the next year, and will continue to feature as we go through the medium-term financial plan. So if I get into the new savings proposals for 25-26, so obviously these are child and family services proposals, and really thinking about what does do these actually mean. So obviously there's the services, they play a vital role in protecting vulnerable children, helping families through the hard times, finding, fostering and adoptive homes. So in terms of the child and families target operating model, they're very much the principles that apply. So what do these savings mean? So these involve reducing that reliance on those high cost external residential and independent fostering placements, and focusing on growing the own council services as we move forward. So we would look at the supported accommodation and residential numbers, of actually reducing them down that way, and actually looking after children ourselves, growing our own fostering placements. And then there's one at the bottom that looks at the income for the Bova activity centres, so how we would generate more income in terms of a commercial market to bring money back into the service that way. Other ones for child and family look around applying fees for fostering and special guardianship, and that's about actually only applying the uplift for inflationary uplift. So it kind of shows that we're covering that, and that we're covering the minimum allowance in terms of a national picture, so we're not an outlier. So rather than increase more, we would increase only to that allowance, so that we are still supporting fostering and special guardians as we go forward. And then the last one is around independent commission care, and what we're looking to do there is not to apply a generic uplift of 8%, which would be around, say, 5% to all existing external providers, but take that as a case by case, so that we actually understand what profit looks like in those arenas. Because if you think of Welsh Government's agenda to eliminate profit from the market, we don't want to be giving a generic uplift to everybody. However, we do need to recognise there are pressures in the system, so it needs to be assessed on a case by case basis, so it goes to support those who are supporting children directly. Okay, if I move on to adult services then at the moment, so these are specifically looking at how we change the operating model, as Amy described in terms of the target operating model, to sort of seek to support, so commission less of the external, but actually support for the amount in terms of those efficiencies. So again, looking at maintaining the number of supported accommodation placements, but with that reduced or different package of support, looking at early help and intervention, and how that might fit the needs of the people as we go through them. So there's a lot of them, they look big numbers, but in terms of the context of the overall budget position, they're not, and they are small reductions, and it's mainly focused on efficiency. The other ones then, in terms of then it looks like maintaining the number of younger adults and learning disability, looking at those support packages of care to make sure that they're meeting the needs of people within the best possible services and the way that we can do it, and the same for mental health. So it's looking at that, driving down those really expensive externally commissioned packages of care, and understanding how we can do things differently, still to make people's needs, but in a much more efficient way. Last set again, in terms of for reduced costs for, sorry, Mark, do you want to come in now? Sorry if I just pause for a second there. It's okay, sorry.
Okay, Mark.
Thank you. you mentioned that there's going to be a reduction in external placements. With it, are you forecasting a negative effect on the respite care in the immediate future, or have you covered all your bases for that?
I would imagine it would be and no, I don't think we're talking about respite. I'm just going to pause for a second and bring Amy in for a sec, if that's okay.
Yeah, no,
I don't
you're
think
absolutely
so.
right.
Yeah.
Not respite. Yeah, no
No.
respite cases. We'd be looking to increase the amount of respite weeks, both
Yeah.
available internally and those that we commission where these are required. But no, this is about other residential placements.
Yeah.
Okay, thank you much for clarifying.
Sorry, can we keep the questions now until Jane is finished, please?
Yes, Chair, of course. If I keep going, I'm nearly there in terms of
Okay.
okay, is that okay? So
Yeah.
the set of proposals here is around reducing the cost. So it's really maximising the use of our in-house provision, I think, in terms of residential and domiciliary care, and looking at a different way of providing in-house dom care and in-house provision, so that we're making sure that we're utilising our own first in terms of those savings proposals. The last one is obviously continue with our in-year recovery plan, so which we're hopeful we're getting there. I'm sure that you've already spoken about that, especially in adults scrutiny. And that's all of the savings proposals, but it's just in terms of just a bit of on the risks as we go forward, is that whilst we're confident that we can get there in terms of our target operating models, there is that risk around demand outstripping capacity. There's that risk around grants that we've talked around and how that impacts on our prevention agenda, which then would lead to more recourse to statutory services. There's the ongoing risk around the reduced level of client income as cost of living still increases, and then there's the ongoing recruitment and retention for us to deal with as we move on. Again, the cost of living impacting on people and services as we go forward. So there's still lots of risks in the system, but I think when we've come to the conclusion, this is the best way of actually mitigating them going forward. So our savings in the MTFP, again, aligned to our target operating models and our transformation and business improvement plans over the next 4 years. Continue to work in our way of embedding co-production throughout everything that we do, and making sure that when we design and deliver services with people, in terms of meeting those increasing demands for those best outcomes as we go forward. And I think that's the end of the presentation. So if I pause there, and then we can take questions, if that's okay, Chair.
Okay. Thanks, Jane.
Thanks.
That was very succinct and put over very clearly, so that was useful for us, I think. I'm sure there will be a fair number of questions. I know Jeff has got his hand up, and I will say to members, if you will put your hand up, electronic one, so that I can pick it up, then I will be grateful. So I know, Mark, you've already had one question, so I'll go to Jeff first of all, and I'll follow up with Sue then afterwards, and come back to it afterwards, Mark.
Yes, thanks, Paxton. Yeah, there's a lot to take on in, even with the papers and so on. I know, one of the pages you actually said, you intend to spend less, spend well, and spend wisely. But reducing the amount we actually pay for, shall we say, external commission services, and you're not actually talking about it being in-house. Number one, to actually calculate something that you perhaps haven't done so before, what sort of impact is that going to actually have on your present staff membership? Will you need more staff to actually do that? Because it's going to be quite a complicated thing, I assume, really, with a number of cases when you actually look at it. So that's the first sort of question. Somebody want to tackle that first?
Sorry?
So if I go, because it is different, and then I'll probably pass to Amy for what that means for adults. But in terms of children, then yes, it does mean that we would be looking to increase our in-house provision or work differently, which has been obviously factored into the budget planning as they go forward, in terms of the children's like growing our own fostering foster carers and residential placement. So that has been factored into the budget. If I pause there, Councillor, and leave Amy do the adults one, I think it'll be, is that okay?
Yeah, can I come in on the adults? So I think there's a number of different proposals. So I suppose taking something like internal residential beds, it's about using those beds as efficiently as we can and slightly differently, because at the moment we provide things like reablement beds, respite beds, long-term complex care beds, and also step-up beds from the community when people need an emergency placement. And sometimes the timetabling of those doesn't always fit together. So there's opportunities there to be more efficient and just use our homes in the most efficient way. So yeah, not saying we don't do that at the moment, but we're just looking for all opportunities to improve on that. So basically with residential, it would be no more staffing, dom care, no more staffing, just looking at things differently in terms of how we're doing our runs, how we're doing our where different officers are working across the county, yeah, in terms of day as well. But I don't think that came under that heading. But yeah, in all those provisions, we're not talking about increasing the staffing in internally in adult services.
Okay, yeah, thanks for that. So really, it's not going to be there's no impact really on the present staffing levels, which is okay, a good thing, and so on. You're actually on about present services. We were actually passing Parkway yesterday. That's been closed. That's an internal provision, shall we say? It seems really that that's a total waste. So why hasn't that actually been perhaps brought into being or really sold up at the present time? What's happening with Parkway and Scrutiny?
I might have to check
if we want to use internal services, why aren't we using that?
Amy?
Residential Parkway isn't owned by us anymore. So that's a quick answer on that one.
It's been sold, is it?
I will wait for our colleagues in property to contradict me. I know they're not on the call, but yeah, my understanding is it was sold quite a while ago. And the Parkway day service is used. That's in Scrutiny as well. So I just wanted to reference that. That's used both for our flexible support team and a day service as well.
Okay, thanks for that. Sorry, okay. If I can just ask one other thing, we are actually on about savings on page 57. Perhaps it's just a point of clarification. There are savings put forward there with regards to reduce the uplift paid to external commission care providers below what is required to cover the cost of real living wage and other inflationary costs. What exactly does that mean? Other than we're actually going to pay them less. We've actually brought in the provision of the real living wage, and I think that was the selling point really for people outside the service to be more attractive to being involved in the caring sector. So does that actually mean that we are now, shall we say, taking our provision and leaving it to the external market to make up the difference? What exactly does that mean?
I think, sorry, Chair, if I can come in, I think that needs, if there's an amendment that's needed on the paper, because we still are, I'll check it's page 57, because we are still maintaining that real living wage commitment.
I agree, absolutely. I think we made that clear.
Right, so that's right, okay. So, by reducing, shall we say, the provision to the external providers, so are we asking them to make up the difference? I think there are figures actually quoted of reducing external commissioning care by 5% and external length of stay by 2.5%. Who's going to pick up the difference? How are we going to manage these reductions? And what does it mean really to the, shall we say, to the user of the service?
So if I go first, and then I'll pass over to Amy, if that's okay. So
yeah, okay,
we wouldn't be expecting the external market to pick up the difference, and we wouldn't be expecting any difference for the service user. What it means is there's a different offer, and actually that would cost less but still give the same outcome. So it's definitely not passing it back to the external provider to pick up any difference or any less for clients. But I'm not 100% sure if I've just covered that completely. I'm looking to Lucy and Amy to say yes, I have, or not.
Yeah, I think
Yeah.
the thing about accommodation as well, where we talk about people having less accommodation or the average length of stay, it's about our approach, that targeted operating model, about people remaining independent for longer. So I think what we're hoping for is when people go into permanent long-term residential or nursing care, it's as late as possible, really, and people have been enabled to stay in their own homes for longer. So that's certainly an approach we're taking at the moment with our reablement, our resettlement approaches, providing more respite and more support for carers as well, which will enable people to stay in their own homes for longer. So that's the strategy. The 2.5% at the moment is around, or is it the 2.5% figure? Again, we're just going to work on this over the next year to try and get to that point as well.
Yeah, sorry, I'm going to go now. My worry has always been really that we put in more and more burden on the, shall we say, private carers. I'm not talking about the private industry and so on. I'm talking about the carers in somebody's home. You know, the pressure is being
the families. You mean, Jeff?
People. Pardon?
Are you talking about the families?
The families, yes. Good word. Yes, it's the families, really, more and more pressure on them. We making the savings and so on. It's just been pushed down to them. So anyway, that's my thought.
Okay, thanks, Jeff. Sue?
I suppose my question is really, what are the implications for the new national insurance charges for both in-house and external providers? Have you factored that into the budget?
Okay, shall I have a go at
Who does
this
come
one?
in?
Yeah. So yeah, well, we have as much as we possibly can. We're still obviously still working through the details, but in terms of NI implications factored into the main council budget, yeah, I think Ben has done that centrally. What that looks like for external providers, I think it's fair to say we're still working with them to understand what that looks like in terms of what might flow from UK or Welsh government. But yeah, of course we have thought about that, because there are real pressures across all service areas, aren't they, as they go forward?
Yes, there are. My concern is that the external providers maybe will be reduced because of all the charges that have been put on them, you know, and where will that leave us as social services in service?
Definitely a factor for us to continue to work with the providers and the third sector on what that looks like. Yeah, but definitely on our radar. It's difficult.
Thanks, Jane.
Thanks.
Just to follow up on that, if I may, obviously the government has said that they will compensate local authority organisations in terms of the increase in NIC. What they haven't said is that they will do that in total. Are you anticipating at this stage that it is going to be in total, or have any sort of thoughts been given to what the situation will be, or what you will have to do if it's not covered fully? Or is that not a fair question for you?
I don't think anybody can answer that.
Well, I think there is a case to be made that just to be careful, you ought to be looking at potential contingent action if that should be the case, if it's only covered at 90% or 95% or whatever. Yeah.
Yeah.
Okay.
Can I come in and comment on that, Chair?
Of course you can, David.
So we know from our calculations that on the current budget that's before you today, we can afford, on average, it works out about a 6% uplift. Now we, in response to the specific challenge around national insurance, we think that just about gets providers there, but different providers are in different positions. So I think when Jane talks about we'll remain open to talking with individual providers around whether they have a particular problem that 6% allocation doesn't, or around 6% on average, doesn't cover. So if there are individual providers who are struggling, which has happened in previous years, we'll then look to see what we can do to help that provider to manage those costs in the same way as we would when they've had problems in the past. I think where the council still has a structural risk, which I think the panel's picking up on, if it turns out, we don't think this is the case, but if it turned out that actually the whole of the market was undermined by you know, a 6% or an average 6% allocation not proving to be sufficient, that would undermine the budget overall, and then we, you know, and then we would have a difficulty as a council. At the moment, we think we've got there, given, you know, councils made great strides to get as much into the system as possible to then enable that as I say, you know, sort of weighted average 6% uplift. So hopefully that proves to be enough. But as Jane has said, you know, in the same way as we always do, there'll be further representations either from, you know, individual providers or potentially from the market as a whole, and then we might need to revisit that. But that will be a challenge for the council, given that, you know, if we've managed to, or if the council has found. I mean, you haven't signed it off as a council yet, but assuming you do sign it off, you know, it's going to be really difficult to go higher than that, unless, as Jane indicated and others have inferred, if there was more money that came into the system, that would then enable us to further mitigate any structural weakness. From what we've heard from other councils, and people are keeping their, you know, playing their cards a bit close to their chest this year, perhaps a bit closer than they have in previous years, it looks like what the council's planning for is, you know, pretty much consistent with what other councils are planning for across Wales. So we look like we're in the pack, which is helpful and provides a bit of reassurance. But as I say, until we get any further representations, either from individual providers or from the market as a whole, we're going to have to just, as you have said in the panel, just be cautious about, you know, keeping an eye on it to check that actually what is a generous allocation in the great scheme of things, you know, certainly significantly more millions of pounds than we've seen flowing into the sector in previous years, just checking that even with that really generous planned allocation, that there is sufficient money, given that those cost pressures we know, real living wage, cost of living, inflation still, national insurance being the big new one, are significant additional pressures still. That's why the numbers are big, and we still need to be, you know, cautious about, you know, checking that it does prove to be enough. Hope that makes sense.
Okay, David. Thank
you,
you.
dear.
Um,
Can I just
Sue?
just ask another on prevention? I think it just emphasizes that we need to be looking far greater at prevention than we perhaps are at the minute, although it is on our agenda, but prevention is going to be key. Just a comment, really, not a question. Thank you.
I got to agree with you, Sue. I think prevention is something that we've talked about time and time again, the need in that sense to do everything we can in that respect. Mike, you have a question, Mike D?
Yeah, thanks, Chair. I was going to pick up the point about national insurance. I think it's been very well covered, but it's just one thought that crossed my mind following on from your comment, Paxton, about whether the government will be covering the full impact of national insurance increase or a contribution towards it, and actually whether that would include their consideration of the impact of national insurance increase as far as those who are commissioned services as well. You know, it's kind of going to be an interesting question. But the question I've got then is in relation to whether there's anything in the budget proposals which impact either directly or indirectly upon this big issue in terms of working with health authority in bed blocking, in terms of you know, delays in care, in discharge into social care. Is there anything sort of positive or negative in the budgets which you know, will impact upon our ability to see people being removed from hospital beds into community care or positions of you know, home care?
Can I come in on that one?
I
Is that
was
okay,
going to
Chair?
say, Lucy, did you want to come back on this?
Yeah, I can certainly try to. Yes, I mean, absolutely. I think that a number of the savings proposals should, you know, are all about actually reducing the number of unscheduled care admissions in the first place. So we are looking at the start of the system. So, you know, again, coming back to the point about prevention, we would first hope that by increasing our alternative methods of support, increasing our number of people coming through our reablement services and earlier help and prevention, that we would see a reduction overall of people coming in. But of course, then that does mean as well that when people absolutely do require a pathway to home care, for example, following a stay in hospital, that we have the capacity to actually provide it in a timely way. So it is linked, absolutely. And of course, we are making sure that we maintain our services as Amy described. We want to make sure with our triangle that we are preserving our managed care routes for those who most need it in a timely fashion. But yeah, the bigger point really, I suppose, is about preventing those admissions in the first place. So that's where our focus and our energy is at, if that helps.
Okay. Mike, got it? Yeah, okay. I'm going to bring Mark back because he's had his hand up for a long time now, and then I'll come to you, Mike. Michael, if I may. Mark, did you want to come back in?
I think he just left his hand up.
I think he might have. Okay. In
Oh,
that case, let's go to Michael. Mr. Locke, Councillor Locke.
Thank you very much. I'm sure that Mike Day will actually say if I'm saying this incorrectly, because it happened before I became a councillor, I think. But I think Parkway was actually sold to a company that ran it as a private nursing home or care home rather. And then they closed it down, and then it's now hoped to be allocated for housing. So I think that's where we are with Parkway.
It has been disposed of from the council's portfolio.
There we are. Thanks for that.
Okay. Hopefully that's cleared that up then. Chris.
Yeah, thank you, Chair. It's a difficult question, and one I think the officers are going to have a problem answering. So I think it's a question that may need to be looked at further and a bit more researched into it. In all the budget proposals that come forward about realignment, about how you, and with respect, we've heard all this terminology before, and I can see Dave laughing, and it is a question of, yes, you realign, yes, you revamp, yes, you look again at working in a different way. But the reality is the services are cut. And what I'd like to know, and what I think we need to know, is how many hours of actually delivery of service are going to be cut. Now, we all know about the various people that are in the community that need 4, maybe 5, 4, maybe 2 or 3, 4 visits per day. Are we going to have to realign that and say, sorry, we can't afford to give you 3, we're going to give you 2? Are we going to look at Bottom-Mile House and the stepping up bed and the step down and the respite and look at how we manage respite? Are we going to say, all right, respite is going to be in future, maybe 2 or 3 days as opposed to a week? Or are we going to look again then at how we do adaptations to houses? Because one of the big issues with social services is we spend, and I can remember one in particular, we spent £60,000 doing a conversion for a house, and that person unfortunately didn't live there very long. And that really is where we come back to what social services is about. Unfortunately, you, like education, are demand-led subjects. We can't turn around and tell you, you can only spend X amount on people when more people are come in the system. So there's nothing you can do about it. And the same applies to children. You may manage the amount of children you can possibly look after. You can manage, and I can remember going back to the days, Dave, when we had social workers that would go into homes to help parents get children ready for school, because that's one of the major flashpoints. So what I'd like to know from you is, how is this going to affect the public? And are we going to cut down on the amount of calls? Are we going to alter our respite? Are we going to alter our enabling out to bottom my house? And how are we going to affect the children and the quality of service we give to children, especially if we're going to grow our fostering services? Because that's going to take some time. That's going to take some time because it's difficult to persuade people, and the whole concept of family life has changed so much that we don't have a husband and wife or a partner or whatever that got the room to take in foster care sometimes because they live in a 2-bedroom flat or a single bedroom, whatever. So I want to know how it's going to affect the public. And I think these are the fundamental questions, because I believe that we need to argue for more for social services, but we need to be more direct about what we say it's for. Thank you.
So before you come back on that, David, I'll just add to that to say, obviously you've got a 25 million increase in your budget this year, and you're still looking for savings of about 8 million on top. So that implies you were 33 million underspent in terms of what you wanted to do at the end of last year. So those are quite big figures. And in terms of what Chris has already just said, I'm not quite sure what the answers are, but we'll give you the opportunity to come back to us on that now, and in respect of those figures as well.
Yeah,
Over
happy
to
for
you.
me to go first, Louise.
No, yeah, please do, Dave, and
Yeah,
I'll chip in if you haven't said what I was going to say, then I'll come in after.
Okay. So the percentages that are included in the budget proposals are there intentionally to try and answer or be more transparent around exactly what you're asking, Chris. So if we are successful in implementing the target operating models that the heads of service and their senior management teams have developed, I know we only gave a very quick summary of them today to kind of, as a bit of a reminder of previous work that you will have seen. So it shouldn't be complete news to you. And it builds on things like, you know, Sue's description of, we really need to get serious about delivering a more preventative approach across all of our communities, all of our ways of supporting well-being within our communities. If those target operating models are successfully implemented, then the reductions in recourse to care are the percentages that are set out in these budget proposals. Yeah, so it's intentionally framed in that way to try and be more transparent around. It does mean that going forward, we will be delivering less care than we otherwise would have if we hadn't adopted these target operating models. And the financial bet is that those target operating models are a more cost-effective way of supporting individuals than just having ever increasing amounts of recourse to care. But you're also quite right, Chris, as your statutory director to be shortly in a few weeks when Amy hands the mantle back to me, I am not allowed to allow you as a council to fail to meet your social services responsibilities. So if somebody knocks on our front door and requires a particular level of care, we have to provide it. And I would be breaking the law, and I would be allowing you to break the law if that didn't happen. So the bet is, you know, really important for us in terms of getting this right for our population, really important for us in terms of financial sustainability, because you are hopefully going to invest a significant chunk of money, you know, along the lines of 26 million pounds, which would otherwise be, as you rightly point out, Paxton, if we weren't doing it, then it would be at least 33 million pounds, probably higher is the truth of it, if we get this wrong. So how will it play out? If it doesn't work, what will happen is you will see significant overspends still arising across the directorate if we fail to deliver the target operating models in the way that are set out and predicate this MTFP plan. And of course, this is just the first year of the plan, and to some extent, it is a bit of crystal ball gazing. So that's our best estimate of what we think is achievable, and then we've segmented it over the 4-year period. So, you know, we might have got that wrong. We might have got, well, actually, it takes us a little bit longer to meet the first year target, but we deliver it in the second year. Well, how that will play out is we'll end up with an overspend in the first year, and then we'll balance the books by the end of the second year, in theory. You know, it's that's the approach that we're doing. So we're trying to be more transparent, Chris, than we have in previous years, where you're right, we'd have said things like this, we'd have set things out, but we wouldn't have been as clear as saying, this means the council will be providing less care than it otherwise would have. And then those figures are in there, 2.5% in this area, 5% in another area. In children's services, it will be lower numbers of children in residential care. You know, so we're being as transparent as we can, both, you know, with the council and then with the public, given that we will be publishing, you know, these budget proposals. In terms of more detail, which you kind of, you know, alluded to really dive into the detail, I think if the committee are keen to do that, and I can absolutely understand you being keen to do that, then I think further sessions on the target operating models, and then really diving into the detail of what does it mean? How confident are you as a directorate that you can deliver that? How will you monitor to make sure you're on the right track, you know, etc., which is kind of what you do all the time anyway, but you might want to focus in there even more closely, you know, either between now and the start of the financial year, or, you know, as part of your ongoing monitoring, refer all of your monitoring of performance, etc., back to the target operating model to check that we're on track, to get early signs of, you know, do the performance numbers look right? You know, and if they don't look right, surely that would then link to, are you starting to see overspends in different areas, etc. So it's a genuine and I think better attempt this year to be as transparent as we can. It means this percentage less care. It's still big numbers, and it's still done as percentages. It's not, it's not the absolute specifics of, because we couldn't do it. Can't say that person will, have that, less amount of respite, because it would be illegal for us to do it. We can only look at it at kind of population level. I think this is more transparent than previous years, and it will give the panel an opportunity to hold us and the cabinet members to account around how successful are you at delivering both the target operating models and the budget numbers and performance numbers associated with those target operating models.
Okay, thank you, David. Did you want to come back in, Louise, on that?
Yeah, I won't repeat what Dave said, but yeah, I think just my main point was going to be that we don't have that sort of blanket approach. I think as Dave said, as Chris, we're not saying everyone who's currently got 3 calls a day are now going to have 2 or whatever. We're always going to have that individualized approach in terms of what people need. And this work has already started in terms of that investing in the prevention, investing in the early help. I know at the last adult scrutiny, Lucy was talking about the pilot, for example, in the common access point, where we've got a worker who's gone through people waiting for assessments and sort of said, looking at things that are already in the community and saying, right, you could try this instead, you can work with this project or this group, and a lot of those people have found that they don't now need care. They might need care again later in the future, but they don't need that now. So it's about kind of bridging that gap in that way, and in that case. And also Amy has just quickly sent me a specific stat if you do want something that sort of tangible. In December we commission 62,500 hours per month of external dom care, and so a reduction would be 3,150. But you know, as Dave said, to an extent, we're sort of pulling these figures out of the air in order to sort of make it work. But if it hopefully it will work, and it is starting to work, and we will see that outcome. And you know you can question us on that in the future, but it's not sustainable to go on as we are. We have to shift the model.
Are those figures we're going to see in the performance figures now and coming forward?
But yeah, potentially that might be. Yeah, we could look at that, how that's delivered, how that's reported on. Yeah.
Do you want to come back on that, Chris?
Yeah, a couple of things. I think to actually put in those type of figures, Louise, would be quite difficult. Because
absolutely,
it's a massively over complicating the issue, because you're taking individuals, if you like, and you're looking at those individuals and then you're adding them into a database. I don't know if that is an actual good a good method of using your time to actually do this. What I think is more important is that we have the confidence in when we have, say, a 2 monthly or 3 monthly, when it comes to finance and performance scrutiny, that we see the performance figures and they're as up to date as possible. And I think those are where the issues are. And taking Dave's point about being more transparent with the percentages and what have you, I think it's only right that we have been a bit more open and transparent with it. The reasons being is that we get complaints about people saying, "Oh, we're not getting this, we're not getting that." Well, we can point out the fact, hang on, there's 60,000 people in receipt of some form of social services. So it is very, very difficult. And as I said, it's a demand-led service, and as such, we need to have the confidence, I think, that out of that 60,000, we'll say, who are in receipt of some form of social services, that the majority of people are going to get the best service they can possibly have to retain their standard of living and standard of life. And I think that's the thing that drives us as members forward, is to make sure that we have got that. And yes, we'll scrutinize the figures as they come along, but I think the percentages is a good way forward. Thank you, Chair.
Absolutely.
Okay. Anybody else got any other points they want to raise at this point in time? Okay, yeah.
Has Mark got his hand up again?
I'm not sure. Have we, Mark? It's been up there for a long time, Sue. You'll have to unmute yourself, Mark.
Have you lost the button, Mark? Yeah, I think he has.
Is that okay? Thank you.
Sorry. Okay. In that case, I think I'll say at this point in time to the officers, thank you very much for your attendance. Thank you very much for answering the questions that you've had. Perhaps now I'll ask you if you would care to leave us. I know it's always nice to have our company, but I'm sure you'll be glad to get back to the proper day job. And we will then have a consideration amongst ourselves and see what comments we're going to make via the scrutiny, by the service improvement panel tomorrow. Thank you very much.
Can I add my thanks to you all for attending
Chair.
as well?
Bye.
Thanks, everyone.
Okay. It looks like everybody is gone in that sense. Where do we start with this? Who wants to start? Obviously, I suppose one of the things that we can say straight off that we're pleased to see quite a significant increase in the budget for social services.
Yes.
Certainly, I think we saw the same thing last year. but obviously there are concerns around some of the savings that have been made. I'm sure Liz will have picked up a lot of that in terms of what has been said. Any points that you particularly want to pick up that we think we need to take back in a letter to Chris tomorrow so that he can take it through the service improvement panel tomorrow and then off to the cabinet afterwards.
Yeah, it's me, Jeff. Sorry, I haven't put my hand up, but
Okay, Jeff.
you know, I'm glad it's been highlighted really with regards to the percentages they've actually put forward, because and they are confirmation really that this will not incur any additional staff costs really with regards to achieving these or going towards these savings. At the end of the day, figures are actually bandied around, and somebody will have to bear the cost of this. I hope they come up with it, and so on, whether it's the private sector or my concerns really are the public, shall we say, that they take up the slack. So there we are. We shall have to wait and see.
Any thoughts, Chris?
Yeah, I think quite a few, to be honest with you, Paxton. I think you're right enough to say that we are pleased to see the uplift in social services budget, and the fact that how it's, the amount that it's being uplifted, because to be blunt about it, it is an incredibly difficult budget, very difficult service to actually calculate how much people need to spend and how much is required. I think there's a need for an exploration of the foster care system, because I think, yes, we want to see an increase in that, but because of the way in which people can live today, we need to examine what we want as foster carers local, and we definitely need more, because we need more of those children to be encased in a family if possible. I think for elders,
in one sense, you could say, Chris, that the figures are fairly static in terms of looked after children and in terms of children on the register, on the at-risk register, compared with, I think, the situation in adult social services, where the demand seems to be ever increasing at quite a
older generation,
big rate. So I think there's perhaps more stability there, but there's still a move there from what I can see in terms of fostering, to move away from independent fosterers to Wales foster now.
It's the external ones it is, Paxton, and the concern about the Welsh government saying that care shouldn't be profitable. I have a problem with that. I think we all got a problem with that, because we'd have to build our own foster service.
You can actually see the impact of that on the capital program for social services as a whole, because of the extra building work they're having to do to try and create the in-house residential facilities that is required, which they would normally put outside otherwise. Obviously, there's a cost coming through that way.
Yeah, and on adult services, I think we have to realise that part of the problem we have with people staying in their own homes is the adaptations. And I think every ward in the city would have problems, with adaptations, with even the simplest things like putting in handrails and things like that. And I think we need to understand that the adaptations for people to live longer in their own homes is one of the things that we need to have sort of confidence that is going to go forward. And I think that's the way we can help with our budgets and help with people's quality of life.
I think there's also an argument that says, Chris, that if people are staying in hospital longer than necessary, we talked about bed blocking very quickly, the longer that carries on, the less able those people are going to be coming out of hospital to pick up their lives as normal.
Absolutely. Institutionalization.
That compounds it as well, doesn't it? I know, don't get me wrong, I know you made a big play of it before, and I'm sure you will continue to do the same again, but it is important, and that, I think, is the reason why we asked for the bed blocking figures at the last adult social services meeting.
Yeah, it's all about people staying in their own home or getting out of hospitals into the community care, but they've got to have the right packages. And
Yeah.
that's
And it's
part of
got
the
to be in a
problem.
timely time. It's got to be in a timely manner because they do get institutionalized so quickly within hospital situations.
Yeah, exactly. And I think it's that if you need people that need to have a wheelchair or something like that, they can't go into perhaps in their own home straight away. They need to go somewhere as a halfway house, that type of thing. And I think we need to think seriously about how we do adaptations and where the adaptations are done.
But not only that, you know, they're actually talking about reducing externally commissioned care by 5%. That's a hell of a lot, you know. Mental health by 2.5%. I don't know. Well, you know, and to do it really with the same staff that they got. So, you know, where's the pressure going to fall? Oh, that's what I'm
On the
really
staff.
concerned.
I
Well, I
really
wouldn't
don't
say
think
staff.
that.
Yeah, I think
don't-
it's the carers in the house, so, you know, the family members.
I don't think they do those increases. I don't think we can have the cut in service, the members of staff, because otherwise those services are going to be badly affected.
Yeah. Well, our staff is going to be affected, isn't it?
Mm.
Yeah.
You know, they're up
I
to
think-
their limit, a lot of them now.
I didn't think so much that they were talking about staff reductions. There's no sort of redundancy talk in there in that sort of sense. Because I wouldn't have been at all surprised to see a reduction in the number of lacs again, to be honest, this year, which hasn't happened.
I don't think they can do that. They are essential because of prevention. You know, I really think that they are the front line for prevention.
Well, okay, there's not too much point in talking about that because it hasn't happened, if you know what I mean. But which is, I think, positive in that sense. I'm not quite sure where I was going with that now, but basically.
Can I come in, Paxton? I know that it's not something that we can affect as a council, but I think we should register the concern we have about the increase in national insurance and the impact upon the services that we provide as a council, but also upon those services which are provided indirectly for the council.
Yes,
you know, so and your point, I think, lack of clarity in terms of is the total cost going to be covered or not.
Well, it's not that anyway, Mike. In one sense, obviously, it's our external contractors are going to bear that cost, whatever, and we're going to have to pass it on. So it's going to impact it indirectly as well as potentially directly as well, isn't it?
Yeah.
So I don't know. You picking up all those things, Chris, for tomorrow?
Yeah, I had a chat with Liz, and she's going to put together a piece for me, and then she'll pass it through to you and Sue to see it's okay, and then I'll put it together for finance tomorrow and performance, and then again on Thursday to the cabinet.
Okay, that's fine.
Anybody want to make? Could you also mention natural wastage and how that would go hand in hand with the ever greater demand on services? Because I can't see that working. Thank you.
Sorry, that was Mark, I think, wasn't it, Mark?
Yeah.
Okay, I think there's probably plenty there for you to have to take back, Chris, at the end of the day. I don't think you're going to have any shortage of anything to say, that's for sure. It'll be interesting to see what response you get at the end of the day. So, does anybody want to add anything now before I close the meeting?
No,
in that case, I will say thank you very much for the participation. Obviously, Liz and I will have a chat now, as Chris has already said, and we'll circulate a letter eventually, or Liz will circulate something around to everybody to see if they're happy with it, or whether they would like it changed, or whether they would like it added to. And that have to be done fairly quickly so we can get it back to Chris in time for the meeting tomorrow. So
do you want me to stay on Teams with you and Liz?
Yes, you can stay on for the time being. That would be a good idea, Sue, I think.
Lovely, thank you.
Okay.
Thank you, Wendy. All the best, my love, this afternoon.
Yeah, I hope your father's all right. Your father, husband.
Jeff. I know, it's not me. I know. It's horrible to go, but I gotta go.